I've been a veterinarian for 30 years now, and for the last 15 years I've owned my own practice, and I've done small animal veterinary medicine for the last 25 years. I do have some academic background. I worked at the University of Florida and University of Miami in research on diabetes and other diseases in animals. I like to use Flexicult in the clinic because of its ease of use and reliable results and speedy results as compared to other ways that we would check for a urinary tract infection. The couple other products that I'm familiar with aren't as easy to read and only gives you a limited amount of information, whereas with Flexicult, I get the information that I need as far as is there a bacterial infection, what type of bacteria am I dealing with, and most importantly, what that bacteria is susceptible to as far as the basic antibiotics, 5 basic antibiotics that we use commonly in our setting, in our clinic. Usually my alternative to using Flexicult would be to send out urine to our lab, and the cost to the client would be close to $180, $200, whereas with Flexicult, and it would take, for results, it would take 3 to 4 days to obtain results, whereas with Flexicult, I generally charge the client about $75 to $80, and I get answers within 24 hours. I've seen results even quicker than that. Overnight results are not uncommon when I use Flexicult. The Flexicult Vet is very easy to use. We obtain a clean urine sample from a cat or dog that is under suspicion of a urinary tract infection. We seed each well with a few drops of the urine, swirl it a little bit, and then just let it set at room temperature for 24 hours. We check it at 24 hours and compare it to the chart the illustrated chart that we have from Flexicult Vet. And this way we can identify the bacteria that are growing in the wells and identify which antibiotic is best to use for the bacteria that's growing in each well. We use the Flexicult Vet system on cats and dogs that are suspicious of a urinary tract infection, and those include pets that have a recurring urinary tract infection, pets that are urinating often because of diabetes, young puppies that are urinating or are difficult to train, and so we want to rule out a urinary tract infection, and of course elderly pets that are also having inappropriate urinations that we want to rule out either a behavioral or a urinary tract infection. So this is why we use Flexicult Vet, to assure the good health, urinary and otherwise, of our favorite patients.